The latest data show that the number of cases of coronavirus are rising. Yesterday, we saw 3,542 new cases, the highest since the 12th of April. The variant first identified in India, so-called B1617.2, is still spreading. And the latest estimates are that more than half, and potentially as many as 3/4 of all new cases are now of this variant. Now, as we set out our roadmap, we always expected cases to rise. We must remain vigilant. The aim, of course, is to break the link to hospitalizations and deaths so that cases alone no longer require stringent restrictions on people's lives. The critical thing to watch is the link from the number of cases to how many people end up in hospital. The increase in cases remains focused in hotspots, and we're doing all we can to tackle this variant wherever it flares up.
Secretary of State, you've explained why you didn't test everyone going from hospital to care home, but the charge from Dominic Cummings is actually quite specific, and I'd like to try again on that. Did you tell the Prime Minister that everyone going from hospital to care home would be tested, or is Dominic Cummings not telling the truth on that?
Of course, we committed, and I committed, to getting the policy in place, but it took time to build the testing. We didn't start with a big testing system in the UK, and then we built that testing system, and that's why the 100,000 target was so important, because it really accelerated the availability of testing. Because when you don't have much testing, we had to prioritize it according to clinical need. And so that was the approach that we took. In fact, we set all of this out at the time. But it is important in terms of looking back on it that what we had to do was build the testing capacity, because there simply wasn't at the start of the pandemic that testing capacity in place. We had to put it in place, and that's the action that I took. Thanks very much. The next question is from Beth Rigby at Sky.
Thank you, Secretary of State. Just to follow up on that, and specifically, Mr. Cummings said yesterday that you categorically said in the Cabinet room in March that people were going to be tested before going back into care homes. Mr. Cummings went on to say that he and the Prime Minister subsequently found out that hadn't happened. He said, far from putting a shield around people, they were sent back to care homes untested. So just to be clear, did you make the statement in March that they would be tested before going back to care homes, and that didn't turn out to be true because you didn't have the testing system in place? Is that what really happened?
No, look, there'll be a time when we go back over all this in great detail. But my recollection of events is that I committed to delivering that testing for people going from hospital into care homes when we could do it. I then went away and built the testing capacity for all sorts of reasons and all sorts of uses, including this one, and then delivered on the commitment that I made. And that is that's kind of normal way of how you get things done in government. You work out what needs to happen, you commit to making it happen, you go away and deliver on that commitment, and then you can put the policy in place. And there'll be a time when we can go through all of this in greater detail. The most important thing right now is that we've still got a pandemic to handle and to manage, and hence the announcements that we're making today on vaccination and the work that we're doing to try to make sure we keep this epidemic under control.